very short. So the whole important thing is that's the whole focus, is that when you're going to focus on is basically the muscles that makes up the diaphragm and pelvic floor. But we will start with going and revising the pelvis. So basically, let's first start by the hip bone itself. So the hip bone, you know that there are two hip bones, and basically they're merged together, right? And they're forming something called the pelvic girdle. And these two hip bones are joining together with something here in the middle called the pubic symphysis. Remember, right? And basically, this is called the pelvic girdle, where they articulate with the basically the lower limbs, forming the hip joint. Okay? So this is nothing new. I've talked that before. And there are three important joints here that you find in the hip bone. Basically, the first one is the sacroiliac joint. Basically, from its name, sacroiliac. That means it's a joint between the sacrum and the iliac. And you see this joint where the sacrum is joining the iliac bone. Okay, and then you have the pubic symphysis. Okay, basically it's articulation between the left and the right hip bones. And basically you have the hip joint, which you have studied in details in the lower limbs. And basically it's the articulation of the head of the femur with what? Remember? Sternum, right? Okay, that's the three joints. And I need to, I don't know if you remember that the hip joint, the hip bone itself, are made up of three bones. The first bone, you see the one with the red color, is called the ilium. And the other one is called the pubis. And the third bone is called the ischium. See the three bones, guys? And before the age of 17, there are a cartilage here in the middle. It's called the trident cartilage, basically separating those three bones at the point of the sternum. And then they are merged together between the age of 15 to 17. And those three bones form the sternum, where the head of the femur articulate, okay, forming the hip joint. So far, so good. So we said that there are three bones, and these three bones, during infancy and childhood, they're separated by cartilage, and then they're merged together at the age of 17. Okay. So let's start with each one. So the ilium is the largest one, and you see it's the superior part of the pelvis. Okay. And it's also forming the upper part of actually something called the acetabular roof. You see the roof here? This is the roof, which is the superior part of the acetabular. And basically, you need to understand, basically, above the acetabular, the ilium expand to form something wing or the ala. These things, you see the thing that are expanding, the expansion of the pelvis above the acetabular, this is called the ala. It's like a wing, okay? And it has different surface, and we're gonna look at it because there's some important stuff in it. Alhamdulillah. Okay, I don't know. This is very. How can we move this? Yeah. Why this is showing up? Very strange.
Top right, just look for the X on the top right.
Okay. This is for the smart board, right? It's still showing up.
The arrow in the middle.
There's an arrow here.
Yes.
Okay. Still, but it's fine. Okay. So basically, you have an inner surface and you have an outer surface. Okay. The inner surface basically is very important because this surface is called the iliac fossa, where there's an important muscle that are basically attached here. Remember the iliacus muscle that we studied in the abdomen, guys? So this is internally. The iliacus muscle are found in the internal surface. And basically you have the external surface, which is the outside, And this is all for the gluteal muscle. Remember the gluteal muscle? We have 3 gluteal muscle, medius, minimus, and maximus. This is the external surface, which is convex. So one surface is concave, and the other surface is convex. So one is for the iliacus, and the other one is for the gluteal muscle. It makes sense because if you imagine, right, inside you have iliacus, outside you have gluteal, right? So you're not going to forget that. Yes, guys? Okay. And then you have a superior margin. You see this superior margin? Basically, it's a very thick margin, and it forms something called the iliac crest. So you see the iliac crest? It's very thick margin, and you'll see it in the lab, inshallah. So this is where the iliac crest, and basically the iliac crest expand anterior and exterior. You have something called anterior superior iliac spine. You see this is called anterior superior iliac spine, and you have at the back something called the posterior iliac spine. Okay, so you have the superior, and you have the superior, and you have basically you have, by the way, you have 2 superior and 2 inferior. So you have an anterior here superior iliac spine, and you have posterior superior iliac spine, and you have also an inferior one. Okay. Okay. There's an important indentation at the back. You see this indentation? This indentation called the greater sciatic notch. Did you remember the sciatic notch when they studied the sciatic nerve? Okay. This is very important because you'll find that there's an important relation with the sciatic nerve to this notch. Okay. Okay. This is very important. Basically, what's the important relevance of the anterior superior iliac spine? This is very important for you in the clinic. You can do, you can find very important landmarks by just finding the anterior superior iliac spine. So basically, you find that the superior, you can palpate it in the patient, the anterior superior iliac spine, and basically you extend the line from the anterior superior iliac spine to the pubic symphysis. So if you extend the line from the anterior superior iliac spine to the pubic symphysis, and you take the halfway of that, this is where you're going to find, you can palpate there the femoral artery. Okay? Same thing, but if you do that not to the pubic symphysis, you extend this line instead of pubic symphysis, you extend it to the pubic tubercle. Basically, it's like something thick. You can palpate it in the patient. You'll find the deep inguinal ring. Remember the inguinal ring where you take it before? Okay, so this is where you find. So this is an important landmark. Basically, you can find the femoral artery, and you can find the inguinal ligament. Okay, everybody, so far so good? صحيحين ولا نايمين? Okay, good. Okay, so we're done with the ilia. Now we're gonna go to the pubis. So the pubis is basically the most anterior part. So we said this is the most superior part, guys, and this is the most inferior part. Why anterior part? Because this is where the 2 hip bone articulate together with forming the pubic symphysis, right? And basically, this have different component. It have a body, it have a ramus, superior ramus, and it have inferior ramus. What does the ramus mean? It's like an arch, right? So this is the body, guys, and this is the superior ramus, and this is the inferior ramus. Okay. So the body basically is very important. The body because it's articulate. It's articulate with the opposite side pubic bone, right? They merge together in the middle, forming the pubic symphysis. Okay, makes sense. And then you have the superior ramus. You see the superior ramus, okay? And basically, this one extend and form part of the sternum, the upper part of the sternum, okay? And the inferior rami basically go toward the ischium bone, and they form also part of the remember this foramen? Obturator foramen, right? So they form part of the obturator foramen with the with the ischium. Okay, so basically you have together the superior and the inferior rami form part of the obturator foramen, whereas the superior also form part of the acetabulum. Does it make sense, guys? Yes? And remember also we said that the ilium form the roof of your acetabulum. So far so good? Okay. What's the important, guys, of the obturator foramen? There is obturator nerve, and the nerves and the artery and the vein, right? Passing through this foramen, remember? To reach the lower limb. Remember what's obturator nerve? Supply which component of your lower limb? Medial component, basically, right? Okay. Then you have the ischium. The ischium is basically forming the posterior inferior part of the hip bone. Posterior inferior, right? So it's basically to the back and then slightly down, right? Posterior inferior. And this one has a body like the pubis. Remember the pubis have a body and have rami, right? Remember the rami? It has superior rami and inferior rami. This is the same thing. Have a body and have superior and inferior rami. Okay, so there's no difference. So the inferior rami, guys, combine with the inferior pubic rami, forming the ischial pubic ramus. This is called the ischial pubic ramus to enclose this pubic foramen. So basically the inferior together forming this part of the obturator foramen, and posterior inferior aspect also of the ramen for ischial tuberosity. What's the importance of the ischial tuberosity, right? This is where you sit on, right? This is very important tuberosity where your weight is lying when you sit down. And also you have an important part near your superior ramus, something called the ischial spine. Okay, it's a little projection. It's called the ischial spine. So far so good, guys? Okay. I want to talk about important landmark, and basically you have two important ligaments. One is called the sacrospinous ligaments. Sacrospinous, what does that mean? Sacro from its name, sacrospinous. From the sacrum to the spine, right? And this is, and also there's another one called sacrotuberous. Sacrotuberous, from the sacrum to ischial tuberosity. Those two forms very important opening. One is called the greater sciatic foramen, and the other one is called the lesser sciatic foramen. And I'm not going to go on details about the stuff that goes inside and outside, but I just want to mention these. There is an important items. Maybe when you're gonna go details in the reproductive system, you're gonna use these ligaments as a landmark to locate some important nerves or some important vessels that pass through these foramen. Okay, guys? Okay, so far so good. So let's go quickly. Basically, we say the pelvis, guys. We said there are 3 bones, right? What are they? Ilium, ischium, and pubis, right? What's the importance of the ilium, right? The ilium it's the superior part of the pelvis. It also have a wing. Remember the wing? The wing. There is the wing have what? How many surface? 2 surface. External, internal. What's the muscle attaching to the internal? The acus, and the one attached to the external. So the gluteal muscle, right? And then you have an important crest, right, in the top. And this crest have a landmark in the front and landmark in the back, right? What's the landmark in the front? Anterior cervical spine, and then at the back? And we said that you can use clinically this surface anatomy to locate the anterior cervical spine to locate 2 important things. What are they? The artery and the angular ring, right? So what's the difference? It's basically both are halfway, right? One is to the pubic symphysis, another one is to the tubercles, right? And then we said about the next thing is we said next bone is the pubic, right? The pubic bone, is it the most superior, most inferior, most anterior? Most anterior bone, right? Because the ilium is the most superior. And the importance of the pubis, it has 3 parts. What is the 3 parts?
Superior
Of a body.
Superior and inferior ramus.
And superior inferior ramus. What's the importance of superior inferior ramus?
They form the
Superior makes the stubble.
Yes?
The inferior would be the obturator.
Yes, with the obturator family. Excellent. Great. How about the last one with the ischium, the bone? What's the importance of that? How many parts is it?
3.
Same, right? You have a body. Superior inferior ramus, right? Superior inferior rami forming what?
The inferior ramus forms the ischio-pubis.
With the pubis forming
Calling the obturator part.
thread foramen and the superior one forming
That's taboo.
the stabilum. Okay.
And you can sit on the inferior ramus.
And we are sitting on the ischial right? Okay, and then we said the spine, there's an important, there are 2 important ligaments, right? Sacrospinous and sacrotuberous. This is important for 2 holes or 2 opening or 2 pathway. Greater sciatic. Okay, so far so good? Okay. Now we're gonna move to the important part, which is basically the pelvic floor. So you can take a sip of water, take a breath, and we continue. Okay. So guys, you have to understand that there are 2, when you are in a pelvic, the pelvic is like a cavity or like a space, right? The space is basically the whole idea of the pelvic is to protection of important organ, right? Like you have the chest cage, right? The chest cage, what's the importance of chest cage? Is to protect the important organ, right? Which is that your heart and the great vessels. Same for the pelvic. You have the bone, the pelvic bone are protecting important organs. So there is a cavity, which is basically the space, right? Between the 2 bones, guys, right? The cavity have the pelvic viscera. What are the pelvic viscera? Basically you have the bladder, you have part of the large intestine, which is the rectum, okay? And you have the pelvic genitalia organs, and you have basically the terminal part of the urethra. All these guys are located in the pelvic cavity, okay? So you see this space, the one in this brown color. And then there are another part which is the pelvic floor. You see these muscles that are in green color? This is called the floor. Okay? So you have the cavity and there is wall. This is called the lateral wall, which is in the side. And then you have, guys, you have the pelvic floor. So you have to understand, guys, the lateral wall is different than the floor. So the lateral wall is basically in the side, and you have the floor is basically are the one that are forming something you will understand now. We'll talk about, which is called the diaphragm. This is very important for you to keep the organs. It's like suspending the organs. So it helps you in controlling your urination and defecations, and also for female during delivery. So basically, it's like holding the stuff together. If there's a problems with the diaphragm or this pelvic floor, some of the organs might prolapse. You know what I mean by prolapse? They fall down. Okay, and we'll see at the end some clinical problems where you can hear my voice, right? Okay. You'll see that some female during delivery, because they have very intense delivery, that some of the pelvic floor is ripped, and then part of the genitalia fall down. Okay, they have to do reconstructive surgery to put part of the genitalia back. Okay, so you have to understand that the lateral wall have 2 important muscles, and these are the obturator internus. Remember obturator internus? We took it in lower limbs, guys. and the performance. Okay? And the pelvic floor, which is going to be our major focus today, going to be, there is muscle called levator ani, and also another muscle called coccygeus. Okay? So we'll look at these muscles. And this is basically repeat what I just said. The lateral wall have those two muscles, and then the pelvic floor. And it's important, what we're going to be focusing on is the innervation and the function of this muscle and any clinical correlations. So this is why we are studying this pelvic floor, because you understand what will happen to this pelvic diaphragm. So guys, the other name of the pelvic floor, and other people, if somebody tell you pelvic diaphragm, that's mean the same thing as the pelvic floor, okay? So it has two names. So you either call it pelvic floor or you call it pelvic diaphragm. Remember, you have a diaphragm here, which is separating your abdomen from the thorax. Okay, let's look at the, basically the pelvic diaphragm or floor is like a funnel shape. You see how it looks like a funnel shape? And basically it's separated from the pelvic cavity, from the perineum, which is including the genitalia. So it's basically separating your cavity from genitalia. So genitalia is separated. There is like the thorax are separated from the abdominal organs by the diaphragm. Same thing. The external genitalia are separated by this diaphragm. It's a small muscle. Make sense, guys? Okay. And basically, in order for us to allow urination and defecation, there are two openings. There's two holes in this diaphragm for the fluid or the feces to pass. So these two holes also have some important significance. One is called the urogenital hiatus. You see this urogenital hiatus? Basically, it's a passage for the urethra and for the vagina in female. This is the first one. And the other one is called the rectal hiatus, and it's located in the center and basically allow the passage for the anal canal. So you have these two important hiatus that are found in the diaphragm. Okay, guys, you're following me? Okay. So what's the function of this pelvic floor? I'm not going to, I just want to let you know very briefly, there are more important function of the diaphragm, but briefly I just want to tell you that the pelvic floor basically support the abdominal viscera, basically support your bladder, intestine, and uterus through their tonic contraction. Basically, it helps your bladder when your bladder is full, or you wanna, when you wanna empty your bladder. So basically, using part of this muscle in order for you to help you squeeze part of your bladder, and also during for female during the delivery. Okay. And also during your coughing or sneezing or heavy lifting, this is very important. That helps you protecting the organ from very heavy, pressures. If you are, putting a lot of pressures, so this is basically it's not going to impact the organ inside. And this is the most important, guys, the most important function, which is basically anything happen to the diaphragm can impact the muscle. It's important for urinary and fecal continuous. You understand what I mean by this term? So basically, these guys act as sphincter, right? If this function is lost, that means the person cannot control the fecus. Sometime in female, after delivery, you'll find them, any sneezing or any coughing, they can urinate easily, right? Because the sphincter has been impacted, right? Or sometimes, if it's so much, it also can impact for old people, right? Old people, you find them sometime, if they have an injury to their diaphragm, it also can impact their function of defecation. Okay, guys, so far so good? Okay. So what I'm going to be focusing on is three muscles. The three muscles here is the levator ani, which is the largest component, and you have the coccygeus and then the fascia covering these muscles. But you understand that the levator ani is not one muscle. There are more than one muscle forming this levator ani. Okay? So basically we start with the levator ani. Levator ani is innervated by pudendal nerve. Have you taken the pudendal nerve before? Right? Okay? So pudendal nerves is basically coming from the S2, S3, and S4. Okay? And this levator ani has three parts. Pupicoccygeus, and then the pupirectalis and the iliococcygeus. From its name, pupicoccygeus is coming from the pubis, and then pupirectalis is coming from the pubis and then turning around the rectum, and then you have iliococcygeus is going to the part of the coccyx. And you will look at this picture, guys. So this is the levator ani. You see the arrow here, guys? So you see the three muscle. This is pupirectalis. You see how pupirectalis coming and turn around the opening of the anal canal. Okay, and then you have pupicoccygeus. See, it's turning around. This is the second one, and you have the iliococcygeus. This is the third one. Okay, guys, this is the three component. So we'll talk about each one by itself. So we start with the pupirectalis. Pupirectalis, see, I brought an image, so you have three pictures, a picture of three color. So this is the pupirectalis. So the pupirectalis is a U-shape, guys, and basically it's coming from the pubic bone to around the urogenital triangle, around the anal canal, okay? And basically these guys helping in the angle of the anorectal junction. You know that the last part of the GIT, there is an angle. You know that there is an alojugular angle. So if this muscle is impacted, the person will lose the 90 degree angle. So this muscle is very important to keep the 90 degree angle. Okay, guys? Okay. And the most important, guys, function of this muscle is maintain fecal continence, okay? So during defecation, this muscle relax. So if the person trying to defecate, this muscle needs to relax, and then so you can imagine if this muscle is lost, that person will lose the control of the defecation. Make sense, guys? Yes. Okay. And also, guys, you need to understand what happened to the screen. Okay, some of these muscle also go to part of the urethra and vagina. So it's basically some of these muscle contribute to the urogenital hiatus, and basically it's also help in the urinary function. Okay, guys. So basically, this is very important function during sneezing or coughing, to make sure that when the person sneezes or cough, that he will not urinate. So it keeps the urine inside the bladder. Make sense, guys? Okay. So in summary, you have basically keeping the angle, and basically it's an important function in the defecation, right? And finally, it gives part of the urogenital, so it keeps the flow of urine. It stops the flow of urine if somebody sneezes or cough. Okay. Then you have pupicoccygeus. Okay. The pupicoccygeus, you see the green color, guys. This is the largest one, the largest component of levator ani. So it's taking mostly the most part of the levator ani. Okay, you see the arrow? And basically this muscle also coming from the pubis, because it's, again, from its name pupo, that means it's coming from the pubis. And this one, instead of traveling around the anal canal, it travels around the urogenital hiatus, right? And it also it attached to the coccygeus and iliococcygeal ligament. So basically, there are multiple attachments of this muscle. Okay. The last one is the iliococcygeus, from its name, iliococcygeus. This does not come from the pubis, right? So it's coming from the ilium. So it's a thin muscle. It's attached anteriorly to the ischial spine and posteriorly to the tendinous arch, right? And then it's attached to the coccygeus and iliococcygeal ligament. Guys, I'm not gonna ask you about attachment. Why I'm putting the attachment here? Because I want you to imagine where this muscle is coming, right? But if I just put a very simple question, I put like pubic coccygeus, and I ask you very stupid question like, where is it coming from? And pubis is one of the answer. It will make sense that you know the answer, right? You understand what I'm talking about, guys? Yes. Yeah, I'm not gonna ask you about details, but I expect you at least to know why the name pubu coming from, right? Do you see what I'm saying? Yeah. Okay. And the levator, guys, this is the actual levator of the tree. So this is the actual levator of the tree. And basically, this is the elevate the pelvic floor and the anorectal canal. So the most important one of the tree is this one, the iliococcygeus, because this is the one elevate the floor. Okay, guys? Okay. We'll talk about the last one. Remember, this is not part of the levator ani. Guys, levator ani are three muscles. Coccygeus is not part of the levator ani, right? So this is innervated by anterior rami of S4 and S5. Remember, the levator ani innervated by what? Pudendal nerve. So this is a different innervation. And this is a smaller muscle and the most posterior part of the pelvic floor. And this one originates from the ischial spine and travel laterally, lateral aspect of the sacrum and coccygeus with the sacrospinous ligament. You see this muscle, so it's coming basically from the ischium and go and attach mostly to the, you see the sacrum here, guys? So it attaches back to the sacrum and attached to the coccygeus and then the sacrospinous ligament. You can say it's coming from the ischium and then attached to the sacrum, okay? This is in summary how it attaches. Okay, this is very important, guys. So now, we talk about the pelvic floor, right? And we talk it's about two muscles, right? And you know the function of them. Now I want to talk about what would happen if part of these muscles is damaged. So basically the whole function of this floor is keeping helping you with the internal pressure, right? And also during defecations and during urinations. And any damage to this muscle could lead to damage or dysfunction of the viscera that attach to them. So the levator ani muscles are involved in supporting also the fetal head during dilations and the childbirth. So this is an important muscle during delivery, the levator ani. Why? Remember, it has two hiatus, right? Remember the two opening, guys? One of we said the urogenital, which is part of what? It's contribute to the urethra and also the vagina. So if there is the childbirth, the levator ani, this muscle is basically overstretched or overexpanded. So this could lead to a damage to the pudendal nerve, right? There's a big risk of the pudendal nerve being, squashed or damaged. And the two important components that could be damaged, guys, is the pubococcygeus and the puborectalis. This is the one. So basically, you can damage either the pudendal nerve or the two components, the pubococcygeus or the puborectalis. And because these muscles have an important role in supporting the vagina and the urethra and anal canal, any injury to this muscle can impact the urinary incontinence and rectal incontinence. So basically you can impact the function of the urinary or the rectal functions. And as I just told you, the most notable dysfunction is where urinary incontinence happen when there's an increase in the internal abdominal pressure, just as coughing, sneezing, and lifting heavy weights. So basically, this has happened, as I told you, female, when they have a delivery, you'll find that when they lift an object or heavy things, they suddenly urinate on themselves. Or they coughing or sneezing, they come to the clinic for their check after the delivery. So this is some of the dysfunction. So this is, as I told you, see how during the delivery, how much this basically the pelvic muscles can be impacted. So the impacted, sometimes the doctor will need to do incision. You know what I mean by incision?
Yeah.
They need to make a cut in order for the head of the baby to pass. And of course, if the head of the baby is really larger than the allowance, normal allowance, they will need to do a C-section. Okay? This is the last important thing I want to talk about is the prolapse. You understand what the name means, prolapse? Guys, who doesn't know what means prolapse? Something fall down, right? Out of its place. So, sorry, I think somebody's asking something. Okay, so prolapse, basically either the bladder or the vagina can occur if the trauma of the pelvic floor have been impacted. So basically you see the picture, you see how this is the pelvic floor is impacted, and you see part of the vagina and part of the anal canal started to prolapse and fall down. And this can be repaired surgically to put it back, or sometimes the doctor, if it's not that serious, will give some muscle pelvic floor exercises to help strengthen the pelvic floor. Okay? So sometimes they will ask for female, they will ask them to try and squeeze like the pelvic muscles in order to help the muscle go back if she has a problem with the urinations. If it's not that serious, they give them like squeezing exercise for pelvic in order to bring the muscle back to its tone. Okay guys, any questions so far? Okay. And that's it.